Hi everybody, welcome to event number 7 in our free lockdown series on pregnancy and postnatal exercise and wellness. Today's session is all about C-section recovery, and we are going to cover support, exercise, nutrition and management, all specific for C-section recovery. I'm Lorraine Scapins, owner of pregnancyexercise.co.nz, online exercise programs for mums around the world. I've been a personal trainer for more than 25 years now, and I've pretty much almost been in the industry, the fitness industry, for almost 30 years. Ooh, crazy. Okay, so any questions that you may have about your own individual recovery, your scar, your exercise, please let me know in the comments, because it's great to get that more individual approach and recovery for yourselves. And please share, you're welcome to share this video with friends and family. So, C-section. Why do we need to take different steps in our recovery? Why things are going to feel quite different? We also need to think just as much for a vaginal birth, the same our mental wellness also, because often the C-section isn't planned. We don't know we're going to be having a C-section, so we need to deal with it mentally also, which can also take time. So that's something what you've got to think about with your recovery. Now, the two different kind of scenarios, obviously they're all a little bit varied, is elective versus emergency C-section, and there can be different variations again of this. Now, if it's elective, which is often due to a medical reason, so let's say for instance baby is breech, okay, and mum needs to have an elective C-section, mum goes in nice and controlled, nice and relaxed, can ask, she's got time to ask more about the C-section, her partner can be with her, she can get the music playing. It's much more relaxed. There's no rush to get baby out because baby's not in distress. Mum's life's not at risk. So it's done much more relaxed. Take the time going in, pulling baby out, comes out nice and easy generally, and stitch mum back up. That's a very different scenario to an emergency C-section, when the increased chances of C-section now is when baby's not coping very well with the stress of labour. So baby's heart rate fluctuates, mum's in, bangs in straight away for a C-section, got to get baby out. So even in those circumstances, those rush emergency circumstances, when mum or baby's life's at risk, they're not sure what's happening with baby, baby needs to be pulled out very quickly, there's generally a lot more scar tissue because they need to go in maybe a little bit wider. Baby's pulled out very, very quickly, so possibly more internal bruising for mum. Okay, and then mum is stitched up. Probably not more rush, but generally still looking at everybody, making sure everything's okay. So it's quite different recovering from what we call a relaxed C-section compared to that more medical emergency. So just think about that when you're recovering, especially if someone says, I recovered in a week. Don't try not to compare. Everybody's situation is quite different there. All right, so C-section, when they go in, it's generally just one. They'll go in very, very quickly, and you guys who've experienced that, you're holding baby very quickly. It almost seems like a couple of minutes and baby's out. But stitching you up can take 10 to 15 minutes because they've actually cut through 7 different layers of fat and tissue and then into the uterus to get baby out. So it takes a long time for them to stitch up all those layers correctly. Now, how well your surgeon, your obstetrician does this will generally depend on how your scar and tummy looks after. The variation in C-section scars is massive, and it's big from country to country. Those with higher C-section rates and generally more of an elective C-section rates, which we see in, definitely we used to see it a lot in Brazil and other countries, those C-section scars are probably about this size, okay, compared to normal, and then depending if they struggled, you know, to get baby out. And it's very, very rare we go for that vertical scar now. We don't tend to not see that. We tend to not see the staples being used also. So just think about all those layers of scar tissue that's being built up for your recovery. Now, what I mentioned in that 6-week exercise talk last week is that when your scar tissue, when everything's being cut here and you've got scar tissue, that's a hindrance for the brain to activate your deepest core muscles. So this is what we're going to come into now and in today, is to teach you better ways if you've had a C-section of how to activate and contract your transverse abdominal muscles. Now, how and when can you do this? So post a C-section, you're on a lot of medication, definitely for the first couple of days, and you can manage that with your own pain. The best things what you can do in hospital is you will probably be asked to start to walk around. I'm not sure, you know, again, it depends on your situation within that 24 to 48 hour mark. So what you guys need to do is, hopefully you've been doing your Fit to Birth Mum program in your pregnancy, okay, because then you've got a lot of strength from your upper body. Okay, so when you're lying in bed with your C-section, okay, you don't want to put any stress on the scar tissue because that's trying to heal at the moment. So make sure when you come up, if you can, you either roll to the side and push up using your tricep muscle there to your side. So you roll over and push up. You've got to use your arm strength, got to. Or if you're semi-inclined in bed, what you do, push up and take all your body weight into your arms as you push up and sit yourself up and back. So really think about using your upper body strength, because all this is exceptionally weak and we need to think about keeping that scar tissue, all that healing, nicely together, especially for those first 7 to 10 days to help with healing. So think about that when you're getting up, when you're moving, use your upper body strength. When you return home and you're starting to think, you know, lifting up and getting down, again, push off with your body strength and use your legs. It's a good idea, you can lean forward a little bit, take the pressure off onto your legs and push up, as opposed to trying to stretch up and sitting up. You've got to watch that fast movement in those first 7 to 10 days. All right, so when you think about it, and again, this will depend on if you pushed, if you went straight in. Often with an elective C-section, you're probably going to be able to feel your pelvic floor muscles quite quickly, and you can start to think about that, you know, 3 or 4 days after your C-section. Just see if they're working. Okay, see if you can stop your pee. I don't want you to use that as a test that you do all the time, but just see if you can stop it. See how they feel. Do they feel a little bit weaker? Do they feel the same? If they don't feel quite the same as what they did during your pregnancy, then you can start to do some contract and relaxations with your exhalation, with your breathing, and you can do about 10 reps of those every day. So you can start that exercise quite quickly, even after a C-section. Now, what we do need to do is, remember you're going to be picking up your baby. You're not going to be picking up your baby for 10 days. You're going to have them in your arms. So what we need to think about doing is how you're doing that without using your back muscles, and learning to use this as support even when it's still sore, okay? Because you're going to be carrying, try and avoid at home lifting anything for the 7 to 10 days. What you want to do is make sure you've got baby on that change table and keeping baby tend to be at this height all the time. So again, what we've just said, when we've got up, when you're getting up to breastfeed, you're pushing up and using your upper body strength and your leg strength, all right? Because ideally, we need to start to activate your core muscles, your transverse now, 7 to 10 days post a C-section. All right, now you shouldn't feel too sore at this point. If you're still feeling really sore in this area, don't go, just manage it, maybe 2 weeks after. But again, the more lifting you're doing of baby, the more household things you're trying to do, okay, you're gonna need your core muscles switched on. And let me just give you a tip as well. If anything increases pain and aching feeling here, it generally means you've gone a little bit too hard the day before. So once you start to walk, don't walk and do household stuff. Choose to do one thing a day. So, okay, I'm going to test it out. I'm going to go for a 10 to 15 minute walk. Do I feel okay the next day? Yes, I'll do some housework on that day. Okay, so you're not doing walking, housework, more lifting on one day, because that can definitely increase soreness. So you've got to pace yourselves, especially for the first 4 weeks. All right, so let's activate your transverse. Now, the easiest way to do it once you've had a C-section is, first of all, you can do the cough test just to see if those muscles can fire up. So you can see if you can feel them. And this is often good when you've had that C-section to see if you can contract them in standing up in this position. So what we're trying to do is it'll be right underneath your scar, will be here, and then right underneath you put your fingertips underneath where your scar is, and when you draw your belly button in towards your spine or think about zipping your jeans up, you should just feel a little lift there. Can we see that? If you watch my pants, you can just see a little lift. That's when my transverse on. Don't want to see that. We don't want to see that. Okay? So it's just a little hug up. You'll actually probably, if you can feel, and you might need to lift up your stomach a little bit here with one hand, you might be able to see your scar, your C-section scar, just lift up a little bit to know that it's on. So your transverse activation is very subtle, very subtle. It shouldn't cause any stretching, shouldn't cause any pain or any discomfort. And what I want you to do is you make sure you have your transverse on when you exhale. So you do those contractions. So this is what you want to do. If you can feel it standing up like this, I'm going to come down if you can't feel it. So I want you to do 10 to 12, probably 2 to 3 times a day. Deep breath in, exhale, switch on, inhale, switch off, exhale, switch on, inhale, switch off. Every time you lift baby up or lower baby down to try and bath baby, you're exhaling and switching your core on for support, lifting baby up, exhaling and switching on. And that's really going to start to protect not only your scar tissue, but your back as well. Now, where we start, this is where we kind of start in the Birth to Fit Mum program for those who have had a C-section. And you come so good and easier for you to activate your transverse abdominals post a C-section in a 4-point kneeling exercise. All right, now, and it's also good as well if you always have support, just enough. Your pants is perfect. I'm going to talk about support in a minute. Okay, over your abdominals. All right, so what you do is when you breathe in, let your belly completely drop and relax. Now, because all your internal organs are down here, sending messages to the brain so it's easier for you to connect. And as you exhale, you lift up your belly button towards your spine. You're not doing this, okay, you lift your belly button up and scoop it up to your heart, and you should feel those transverse abdominal muscles switch on, or think about zipping up your jeans. Now, for those of you who could feel your pelvic floor muscles activate, fine, pretty much normal. You guys just think about your transverse, okay, because they're generally weaker at this point after a C-section. If you are struggling to contract your pelvic floor muscles the same as your TA, you think about both. So you think pelvic floor, transverse as you exhale. And again, we go through all of this in the Birth to Fit Mum program. So they're your basic first exercises from that C-section birth. So thinking about your pelvic floor muscles, activating your transverse, either standing up or in that 4-point kneeling position. With your exercise, we moderate it a little bit more after a C-section because of the scar tissue and because of how it feels. So for you guys who want to start off with your basic exercises, obviously we can put in the stretches. That's going to be really, really beneficial for you, so your upper body stretches. But just let me show you one thing. What I want to make sure that, so none of you are doing it because it can increase. So you may see, obviously there's a lot of exercises where we do leg slides for your basic. Often, if you're only 2 to 3 weeks post a C-section, that scar tissue can twinge and pull when you're sliding your leg down. So you want to modify it. So you do a half slide. This is if you're starting early, okay? This is like that 3 to 4 week mark. So you do, and you can put socks on, so it slides down easier. So we do those, okay? And you can start really good exercise because it puts no stress on the C-section scar, and it starts to activate your glutes and a core of bridge holds. 2 perfect exercises for you guys to start off with quite early on post that C-section delivery. And then also you can start to then build, as you would do, once you've got those basic initial movements right, once you know your transverse is okay, scar tissue is starting to heal, then we start to jump on and follow the program as you would do after a normal delivery. Now what you need to remember is, what we know now is at the 6-week mark, post a C-section, your muscles and the tissue and the connective tissue is only up to around about 30% recovered. So the strength of your core muscles, the muscles and everything that's happened there is only at 30% at the 6-week mark following that C-section. So that's something that you really need to be aware of and continue to think about, because often, especially if you've exercised during your pregnancy, you're starting to feel really good at that point, and that's where taking that tip, what I told you before about that increased soreness or that aching, that is one sign that you've gone a little bit too far post a C-section recovery. Now, one thing that you are very rarely ever taught after a C-section by your doctors or by your midwives. I'm just going to try and lower this phone down, because if I can turn this a little bit, maybe if I do that and point it down, that's going to be better. I'll just put this up a little bit. Remember to ask me any questions as well if you want. Okay, I'm just going to try and stand it like that so you can see me. All right, is scar tissue massage? I'm on a wonky angle there now. All right, but you're going to be able to see clearly. So around about, once you can start to touch your scar and it's started to heal, so the scabs are falling off. So it's anywhere around 3 to 6 weeks postnatal. What I often say to mums is, you know, when you're in the shower, you can start to massage your scar, because when you're in the shower, if you get a chance to have a shower, you're quite relaxed, the water's warm, your skin's feeling quite good, and you can start to give your scar tissue a deep tissue massage. Now what you want to do is start off in the shower, and you can do this with the shower head as well, it actually feels so good. It's just to start to go along the base and underneath the scar, and your fingers will run and start to see how it feels. So just pushing across, a little bit of gentle pressure across, and then the pressure eases off, and then you can start to come the other way. And then once you've started to do that, once I tell mums is to start to work on one corner of your scar tissue, okay, with two fingers, and just slowly start to go along the scar tissue like this, so you're dropping in, okay, and then you find a lump, and then you just stay on the lump and gentle rub just for a couple of seconds, and then move along as well. So you're starting to break down gently that scar tissue, and what you need to do is work all the way across your bump, finding those little bumps, and try and smooth it out, because that's what you're trying to do. Because when we have scar tissue, and this is after an injury as well, let me just put that up back straight. So when we have scar tissue doesn't heal like nice and straight like this, and we know this after an injury. You know, it's bulky, so we need to try and, with massage, is lengthen out and stretch out those fibers so they're nice and neat. And if we can do that, the brain can get signals through quite quickly, all right, rather than it all being, it's the same with trigger points, you know, in your neck and shoulders. We've got to get them out so the brain can send its signals down to use the arm correctly, okay? Same with your scar tissue here. If you can reduce your scar tissue, it's going to certainly help not only with your healing, recovery, but going and thinking about second and third C-section births, following on from that. Also, something just to point out is numbness. So many women underneath the scar, or just in areas, you will have been numb through your pregnancy, but you may not have noticed it. But now that you've had that C-section, a lot of women say how numb it feels underneath the scar. Now this numbness can last for around about 12 months. It'll start to ease off in that time. That again, this is your healing. Some women can be left with a little bit of numbness. So if you're feeling like that, it's just a normal side effect of a C-section delivery, and it should start to improve, but it will take time. Oh, yes. All right, yeah, so it is quite frustrating. Where I want to get to now, and I know I've been on for quite a long time, but so I've covered a lot of the basics for you guys to help with your recovery, your exercise, your scar tissue massage, looking after your scar, how to cope better throughout the day with your function, contracting your core muscles when you're lifting baby up. What I've not talked about is your nutrition. Your nutrition following any surgery and birth is really, really important. And often, if you're in a hospital, the food is diabolical. It's actually not set up very well for anybody, patient being in hospital. Okay, so you need to make sure not only are you increasing your fluids, so when you're breastfeeding, you've got a lot of fluids, drugs in your system at the moment. You need to flush those toxins out, the pregnancy fluids. You've got to be drinking 3 to 4 litres of water a day. Have to be drinking that. Okay, so really make sure you've got your water up. Not only is it important for your breast milk, but to get rid of all the waste from your delivery, from the drugs, and it also increases your energy as well. So you can be, your tiredness can increase, but you have got a lot of drugs in your system too. So to stop a lot of those negative effects, you know, because you can have different SUI issues, not SUS, urinary incontinence. You can have different infections, urine infections. That's where I was going to with that. Protein is massively important. All right. Someone's just asked me, did I have a C-section? No, I've never had a C-section. This is all my experience is with all my clients and mums who have had C-sections, and I see a lot of women in New Zealand at the moment, new mums. I see around about 15 new mums a month because I teach to that antenatal and postnatal classes in the whole of this area up on the coast. And our C-section rate here tends to be around about 50%. So there's quite a lot of mums who do end up with C-sections, and that's for many reasons. Also, we know that definitely 25% are due. That's by the WHO, the Worldwide Health Organization, is there is definite need for 20 to 25% of all C-sections. I believe most of the C-sections occur for that definite reason. What I said before is baby decides that he's not very happy or she's not very happy, baby's quite distressed, and that's one of the more common reasons. Another common reason as well is a woman going into birth and them not realizing the baby's position, and baby's presentation is another reason. If they're just not right, if baby's head's not down in that optimal fetal position, the cervix, your cervix cannot dilate, and again, if you can't dilate to 10 centimeters, that's generally going to be a C-section. They're just, I think, what comes through as the top reasons and what we're seeing in New Zealand for that C-section rate. But going back to your nutrition, protein is really, really important. Healing, natural healing, internal healing, cellular repair. You know, what do we tend to have as mums? A piece of toast and butter on it, or a piece of toast with jam on it. Let's try and put a piece of toast with some peanut butter on it, because then you're getting the protein. If you're having an apple, have a piece of cheese with that, or have a handful of nuts. You know, so try and think of upping your protein intake throughout the day is really beneficial. Okay, let's have a look. Okay, Kirsty knows she's having a C-section and you're scared. Yep, placenta previa. Yep, that's another common where the placenta is just low. It won't move out the way. It's not come out the way. It's full closure. So Kirsty, possibly around 38, 39 weeks, you'll be having your C-section. Look, you know what your recovery is now. Try not to worry. I know it's always a worry going into surgery. You're going to have, I think what surprises a lot of mums is how many people are actually in the C-section room when you go in. There could be 10 or 15 people in there, which is very, very different from being in that birth room where there's only probably 2 or 3 people, and the bright lights. And it can be quite anxious. And Kirsty, I'm not sure where you are at the moment, but I know here in New Zealand, when we were under level 4, that mum's prep was by herself, and then dad, the partner, could join her just about half an hour before going into the C-section. So hopefully where you are, your partner is allowed to go in with you. Take your headphones in there. You can take music in there. It is going to be over quite quickly. A lot of women said it feels like somebody's rummaging around like in your handbag. It's that sort of type of feeling. Oh, you're in Auckland, Kirsty. Okay, so that's hopefully what will happen for you. One of the mums couldn't give birth couldn't have a C-section at North Shore because they were too busy, so she went over to Waitakere, but just couldn't give enough praise to all the doctors and the midwives. But just still know that that you still are in control of that elective C-section. Ask as many questions as you need to. Ask for the skin-to-skin contact. Once they've checked baby, you can do that, and then you'll be off into your room, and let's get your husband to bring in some protein for you. Actually, I don't know if he can go in or out at the moment. So just think about taking some nuts with you and other protein sources, what you can take in to help your recovery. I'll just have a look here, see if there's any more questions come in. Yep. Okay, so hopefully, you know, we've gone through quite a lot there, everybody, and hopefully I've answered a lot of your questions. Remember, you can start our Birth to Fit Mum program 2 to 3 weeks post a C-section, and you can start to do those little exercises, what I told you, when you feel ready to, when your scar tissue is no longer sore and post your birth. But again, just, you know, you're going to have to go through quite a lot mentally on what you're going in, and then what you're thrown into the hormones, breastfeeding, sleep deprivation very, very quickly postnatal, and you've still got to be concentrating on your own recovery too, and you've got baby to look after. So give yourself, you know, 6 to 12 weeks postnatal to find your feet, breastfeeding, to start to recover, and allow your body to adapt to sleep deprivation. Do you know that takes 3 months in itself? So the best thing I can say is just to give yourselves time. It's nice at the moment with the social distancing, because, you know, you're just sort of with baby at the moment, and there's not too much outside interference. So what I've always said to mums is that first-time mums tend to not follow their gut instinct, which is really sad. We Google and question everything. But I think now with the social distancing and that limit of, I mean, you have got your Facebook groups to chat to, but try not to, you know, you and your partner, whatever you choose to do will be right for your baby, and be right for you guys also. So I think, again, like I said, if any of you have any questions, let me know. Remember, we've got the coupon code running at the moment on all of our programs, and if you could all share that with your friends and family, that would be amazing. We have the coupon code LOCKDOWN, which gives you a 30% discount off any of the programs at the moment, so they're all great value for money. Go to pregnancyexercise.co.nz for those. Also, we have got one more event left in the lockdown series, which is on Monday, which is an arms and core workout for everybody. So it'd be great for you guys to join me then also. But please like and love and share this video. And let me know if you have any questions. Email me, lorraine@pregnancyexercise.co.nz. Visit the website. We've got more information there on C-sections, and I'll put up some C-section tips in this comment feed also, because we got some great tips of women who had gone through C-sections to help all mums either just before or after, and I'll find that blog and I'll put that in the comments for you guys. Okay, everybody, hope you enjoyed that. Have a good day. Kirsty, all the best for your C-section. It's going to be all right. I promise you, it is going to be okay. Take care, look after yourselves, everybody, and I will talk to you all soon. Bye.